All right. Well, good morning. Our focus of this panel is going to be on community health and the impact that communities can bring in terms of promoting cancer prevention and those kinds of things. And I'm really pleased to have such a strong panel. I'm going to ask them to actually introduce themselves because even though I have it all written down here, I'm probably not going to say it exactly right. So we'll start from left to right. From Kim, I'm going to start with you. So would you introduce yourself, please?
Certainly. Hello. I'm Kim Penberthy, and I'm a professor at the University of Virginia. I work primarily in psychiatry and the Cancer Center and see patients there and also do research.
Marge?
Good morning. My name is Marge White. I'm the Deputy Director at the Virginia Foundation for Healthy Youth, and we focus on primary prevention in the areas of tobacco use, obesity, and substance use prevention with youth.
Good morning. I'm Aaron Yao. I'm an assistant professor at the UVA School of Medicine. I'm a health economist and health policy researcher. My research focuses on cancer care and geriatric care.
Great.
Morning. My name is Sahasrabuddhe. I'm a program director in the Division of Cancer Prevention at the National Cancer Institute, part of NIH. I focus my efforts on providing scientific direction and strategic guidance on HPV and cervical cancer prevention clinical trials and expanding access to prevention interventions for cervical cancer.
Thank you. All right.
Hello, I'm Dr. Nancy Reye. I'm a CPA and an MD, and I live up in Traverse City, Michigan. I'm a family medicine physician with Crystal Lake Clinic, and I'm very proud to be here today. My primary goal, obviously, is patient care and making sure that we can take steps towards prevention to avoid disease. Thank
Great.
you.
Good. So we're going to start this morning. Nancy, I'm actually going to start with you. Can you talk a little bit about your perspectives as a primary care physician on the value of lifestyle changes and the kinds of things that you're seeing in the community and the primary care environment?
Absolutely. Well, as a primary care physician, obviously we take care of people longitudinally, and we see a lot of people when they're young and healthy and progress through life. The hardest thing that we end up dealing with oftentimes is the diagnosis of cancer. So my goal has always been to try to help my patients learn lifestyle choices that can help prevent, obviously, cancer, but what also helps prevent cancer helps prevent things like diabetes and heart disease. We have a lot of challenges, and I spoke to the issue with mammography because a lot of times the issues of education, our school systems, our community choices, and policy making have a huge impact on the individual level. And what we end up seeing is that there's a lot of people who either are lacking health care or lacking the education in terms of self-care or the resources. And so in our community, we have the highest rate of breast cancer in our state, Michigan, which is always concerning. We're seeing a lot of people who are being diagnosed with breast cancer at very young ages in their 30s, prior to even screening being an issue. The issues we have are very practical for a lot of these people. They have difficulty affording the medications that they need to be on. They have time that is lost to work. They have to care for their families and pay their bills. And so ultimately, if you look at what we can do as a substantial issue for people on the level of living, is making sure that they don't get cancer. So really my bend has been very much towards prevention in my practice, and I've been very fortunate to have a community that's really reaching out. We've got a lot of proactive people at Munson Medical Center that have really been stepping up to the plate to provide for patients.
Well, that's great. That's great. Aaron, can I have you talk, because you're a health economist, and I know you're doing a lot of work with rural environments.
Yeah. So I'm a country boy. So actually my parents, they don't read or write. So that's why I focus a lot on rural health. And one of my recent papers deal with about the cancer disparities in rural Appalachia. So that's a region, many years ago, President Johnson declared a war on poverty. But if you look at the that region still got lots of problems in terms of cancer mortality rates. They're almost 20% higher than the country average. And if we look at some states, West Virginia and Eastern Kentucky, especially Eastern Kentucky, are almost 40% higher than the country. It's no longer like United States. It looks like a third world country. And we actually look at the disparities across the cancer care continuum, because here we talk about risk, reduction. So for cancer care, in terms of cancer mortality, it starts with cancer risks, then the early detection, then treatment, and the survivorship care and death rates. So we found the disparities across the whole continuum of care, from risk factors to early detection to treatment to survivorship care, every continuum, every step of the process. And very strikingly, so for all other regions in the country, the cancer incidence rates is decreasing, but it's increasing in rural Appalachia in the last 15 years. So, and when we think about risk factors, you can think of the smoking rates is super high in rural Appalachia. It's over 30% of the adults smoke. But smoking, we know that. We started when we were young. In the middle school, high school, nobody really starts smoking after 25. So that's why Nancy, very right. It's about the education system. And talking about the education, in rural Appalachia, there are only about 10% of the high school graduates going to college, and only 3 of them are going to a 4-year college. So that's the place we have lots of problems. And I think there are lots of stuff we can do in terms of public health and healthcare, but without a strong economy, it's really hard to promote public health and healthcare. That's a region with extreme poverty. Their unemployment rates is unbelievable. So I feel like from economy perspective, by only doing public healthcare is not sustainable without a strong economy. So we will need to do more at the Congress here on Capitol Hill.
Great, thank you. All right, we're going to take a quick break, and then I'm going to ask Marge. But we have Representative Dingell with us, and we'd like her to say a few words. So we're going to take this is the fun part of being on Capitol Hill, is when we can catch them and get them here for a couple of minutes. We want them to be able to share with you. So, Representative Dingell, thank you so much for coming.